I distinctly remember during those experiences, especially the birthing experiences, not being hurt. As I go through that experience, and it's paralleled by other experiences that are similar regardless of economic status for Black women, then I become interested in maternal and reproductive health.
Hmm.
And I become interested in studying lived experience surrounding that more deeply.
Welcome to The Bridge, Your Health, Your Voice, the official podcast to the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. This partnership is created to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Paris Barnes.
Hi, and welcome back to The Bridge. My name is Paris, and I'm your host today. And we have one of our amazing, esteemed members from our team, Dr. Jasmine K. Cooper. But before I have her introduce herself, I'm going to describe the way I look. I'm an African American woman wearing ice blue eyeglasses, and I have on a white t shirt, and my hair is kind of red and curly. I'll introduce Dr. Jasmine K. Cooper, and she will describe how she looks and kind of what she does for us here.
Good afternoon. My name is Dr. Jasmine K. Cooper. Um, I am an African American woman. I am wearing black glasses. My hair is in long twisted locks. I have on 3 necklaces, a couple of rings that are silver, and a black and white dress.
Awesome. Thank you so much for being here with us today. I know you have a lot of work that you are doing, and this topic today is really, really important. So, we are going to start with the icebreaker first because I'll just kind of get you warmed up and then we'll jump right into the questions. So, the first one, what is one opportunity you wish you had not missed?
Ooh, one opportunity I wish I had not missed. This is reaching back. I was offered a fully funded master's to PhD opportunity at Indiana University. I think it's Indiana. It was one of the universities in Indiana when I was beginning grad school. And I didn't realize the significance of fully funded until I finished grad school with student loans.
Okay.
So had I the opportunity again, I would take the funding, take the money. Um,
Yeah.
uh, but having started out in grad school, I started out my bachelor's is in Africana Studies. And I started out in Africana Studies at the graduate level, and then transitioned to sociology. And so, had I known the significance and cost of graduate school fully, like had I truly grasped that, I would have taken the fully funded um, fellowship opportunity to and just gone to Indiana.
No, that makes sense because student loans are really grappling and they definitely are looking back at me today. And I've decided that they belong to the Lord.
Yep.
So that's pretty much where I'm at with it. And that's where I'm going to stay. For me, and I think this is probably typical any millennial, we wish that we could have been influencers. Like, why during the
So,
pandemic did we not capitalize on the fact that we were sitting home and struggling? Like the people that were smart enough to be influencers are very, very wealthy now, and they're having great lives and they're doing well. And I'm not saying that they're like rich by any means, but they're certainly not sitting behind a desk every day. So I really, really wish that I would have taken the opportunity to be an influencer of some capacity during the pandemic. I really do.
agreed. Or if I could go back to that time that I was just telling you about, and buy some stock in Google, and that would have been a great,
It really
great
would,
use of my
man.
money.
I tell you.
That would have paid my student loans off. Just
It
saying.
it would have changed everything. It would have changed the entire trajectory of my life. But I'm grateful where I am. Trust me,
Indeed,
listeners,
indeed.
I'm grateful where I am. But if I had one opportunity to kind of flip the script, that's what I would have done.
I appreciate hearing that.
Yeah. All right, and one more. What's one hidden talent you wish you had?
One hidden talent I wish I had is I wish I was fluent in multiple languages. I can speak a bit of a couple of different languages, but I wish I was fluent in like 7 of them. So yeah, I say that's a hidden talent I wish I had. Or being able to play um multiple instruments like my brother can. I wish I could do that, but I can't.
Oh man, yeah. I wish I could like skate. So I always see people roller skating in the videos and they're just gliding and having the time of their life. And I'm sitting here like, I really wish I knew how to roller skate. Like I would love to do it. And everybody's like, take a class. And I'm like, no, my knees have been through enough. You know, I've
Yeah.
pop lopped and dropped it. I've done the stanky leg. My knees have been through enough. So I am smart enough to realize that I am well past the point of learning how to roller skate. So I will just continue to watch roll bounce and enjoy everybody else. But I do wish I knew how to do it because it looks so like therapeutic. But at this
Indeed.
point, I need my knees. I can't like play the games that it takes to learn how to skate.
I mean, one false move and
It's
that
over for you for life, honestly.
oh,
Like, and I'm at an age where if I fall, it's gonna hurt for a little bit, and I'm not trying to do that. I'm good. I need to be cautious. I need my knees.
yeah. Speaking of these, funny story. Funny story. I went back to Michigan to visit my brother and his family, and my 11-year-old nephew challenged me and my best friend to a basketball game with her 11-year-old. Now we used to play basketball, right? So like we got our 40-year-old selves back out there. Now, granted, we won the game, but like my whole right side for a solid week just trashed, completely
I'm
trashed.
telling you, our bodies have been through enough. Like,
Indeed.
I'm good. I no, I'm good. All right. So switching gears, can you tell us a little bit about what you do here and what REPRO-HEAL is all about?
Sure. So to back up and give my just introduction of myself, I'm currently the director of qualitative research with the patients program. So I lead a lot of the qualitative elements of the number of our projects. And prior to this, for 2 years, I was a postdoctoral researcher with the patients program. So I got a good amount of experience in patient-centered outcomes research, in patient-centeredness and community engaged research, and those training spaces, I think, brought me to kind of where I am today. Um, so my areas of specialization, to kind of back up, I am a qualitative researcher, but I'm a sociologist by training. Right. So my master's and my PhD are in sociology. My bachelor's is in African American studies. My work centers and has centered since since I began this journey as a scholar, on lived Black experiences and lived Black women's experiences in particular. And through that lens, I investigate racialized health disparities, maternal and health outcomes, et cetera. So there are a couple of different major bubbles that my work fits into. So there's a reproductive health bubble that my work fits into. That includes maternal and infant health, but it also includes reproductive health conditions, symptom management, et cetera. And then there's the disability justice element of my work as well, where I'm the community engagement core for the Center for Disability Justice, and have led some of the qualitative elements of that work in that center as well. But prior to my time at University of Maryland, I started in 2019 as a postdoc. Um, my work centered on the study of racialized and gender inequality, intersectionality, intersecting inequities in the lives of Black women and how that structured our lived experiences. And so my dissertation work is really where I got a lot of my footing, my grounding. So my dissertation was purely qualitative. One of the elements of it was a media and discourse study article where I looked at Beyonce's Lemonade and representations of Black womanhood in Beyonce's Lemonade, and the ways that she, as a media, not even just media personality, but someone who's using media to convey a message that spoke, that highlighted the structural inequality in Black women's lives, but also that used it to resist, used it to demonstrate the complexities of Black women's lives, the complexity of Black cultures that inform our lives. So that was one article. Another article utilized media and discourse, specifically content analysis, to look at the ways that two Black women who were killed by police were represented in news media. And I compared rates of coverage for them, Corin Gaines and Rakia Boyd, Corin Gaines right out of Baltimore. And then compared coverage against rates of coverage for Black men who have been killed by police and one white woman. And every other group completely exceeded rates of coverage for the Black women who were killed by police, which illustrates a lack of conversation surrounding the issue.
Yeah.
But then there were stereotypical tropes in the representations of those individuals. Specifically, if you look at Corinne Gaines, there's this sort of reoccurring trope in her, in articles surrounding her about,
Yeah.
pejorative Black motherhood, which is a longstanding and stereotypical trope that has been used against Black women, right? So that was one article. And then the final article rested on qualitative interviews with Black women, looking at the ways that we were navigating structured inequality in our lives. And one of the things that kept coming out, despite my intentions not to investigate that, or not even not even intentions not to investigate it, but despite that not being the major area of my focus, I should say, was health disparities. So I was looking at racism and sexism and all of these isms in the lives of Black women and how they were navigating it in that space of 2016, 2017 is when I finished my dissertation. Um, and this is coming off the heels of the post-racial discussions that surrounded the Obama administration, and then this complete, because that's the trajectory of history. Often there's progress, and then there is regression when it comes to racial politics. You could look at you look at the end of enslavement and those three amendments that were passed, the 13th, 14th, 15th,
Yeah.
and then you can look at radical reconstruction, the Hayes Compromise, which is the regression, right?
Yeah.
And then you can look at the 1960s where we have the Civil Rights Act and the Voting Rights Act, and that replicate those three.
Same things. Yep.
They replicate those three major amendments that followed the end of enslavement. So what I'm saying is, in our lives, we see that progress, we see that progression, we see that progress, we see that regression. What's that like to live? What's that like to
Yeah.
experience? And what's that like to live and experience following discussions in the broader media that we're post-racial? We shouldn't be having these discussions anymore, right?
Okay.
So that was my dissertation, and it was three separate articles. But in that last interview article, one of the things that kept coming out was economic disparity that influenced health disparity.
Ooh.
And so and I reference this story a lot because this was tremendously impactful, and I don't think I'll ever forget it. One of the folks who I interviewed, she lived in this area that was beginning to gentrify. And so right across from her street, Whole Foods popped up. So it was within walking distance. She walked and she took her son to Whole Foods. She said, I know I can't afford anything in here, but I'm gonna go anyway. Um, and so she goes in, and her baby's like 6 years old. And he's like, Brooke, mommy, they're selling little trees. And he's pointing to the produce section. And it was a variety of lettuce that he had never seen before. And
Wow.
initially I'm thinking this is like a cute little story or whatever. And she was like, no, they don't bring this stuff to where we live unless it's in this space that I can't afford.
Yeah.
But what do you think that
Wow.
means for what happens to my health and those around me if I can't afford this? And my child hasn't seen anything like this to the degree that he thinks it's a tree,
Wow.
right? So that began to push me in a different direction. And then I had my son. I had my oldest son, and I was actually I was actually pregnant with him when I was defending my dissertation proposal, and then I had him, and he was one at my dissertation defense when I finished
Oh,
all up. So he's a little baby. He actually threw up on me at the end of the defense, but that's another.
that's good luck. That's good luck.
I've heard that, but it didn't feel like that on my brand new suit,
No,
Jack.
that's good luck.
Like,
Mm.
but I distinctly remember, going through the process of pregnancy and the birthing experience. And at that point, I'm a student. I'm finishing my dissertation. I do not have a full-time job, which means I do not have benefits outside of what the state
Yep.
provided for me. Um, I distinctly remember during those experiences, especially the birthing experiences, not being heard, having to physically stop somebody from touching
Mm.
twice, because what they were doing, first of all, didn't have to be done in the way that it was being done. But
Right.
what they were doing was also harming me. So I remember distinctly
Wow.
physically stopping somebody from
Mm.
touching me in the way that they were touching me as I'm proceeding through this experience. And at that same time, there was the story about Serena Williams.
Okay. Yeah.
I know something's wrong. I know something's wrong, but she's consistently not being heard. And so as I go through that experience, and it's paralleled by other experiences that are similar regardless of economic status for Black women, then I become interested in maternal and reproductive health.
Mm-hmm.
And I become interested in studying lived experience surrounding that more deeply. Um, and it's connected to what I had gone through. And so you asked, what do I do? Um, well, I amplify lived experiences to help understand broader social phenomena
Mm.
and broader happenings in the society, especially as they pertain to Black women and other historically marginalized groups.
Wow. So I one thing I'm noticing is that your work truly evolves around your life experience. And I think that a lot of people that do specific types of work don't always draw on their personal and their professional, but for you, they're together. They are literally in line with each other. Your personal and your professional work together hand in
Mhm.
hand, and it is aiding you. And I think that's really brilliant to think about that, sometimes we go through things and we're like, why is this happening to me? But the truth is, for you to be able to do the job that you're doing to the capacity that you're doing, you almost have to have had to go through it so that you could be able to speak to it and know what to look for and actually adds credibility to the stuff that you're reading. So I think that that is brilliant, and that's a wonderful way that you explained exactly what that project is. Because in order for us to better understand the project and what you do, you had to give us your story. So I appreciate your transparency and giving us your story and how that felt for you in that time and what that looked like for you. I know just even I'm a mama too, and I'm one and done because of my experience birthing. I am
Oh,
good. I am
listen, trust me, I hear you.
yeah, I am good. I'm not one that needs to do that again. So no.
Look on your face right now.
No, I love him. He's great.
I just,
But to go through a labor again with an epidural that doesn't work does not sound like anything I'd wish to do in the near or far future. So one
understand.
and done. But I'll kind of segue from that. So because of my birthing experience, mine personally, it was a lot of things after birthing that just never got right. You know,
Mm,
some things never went back to the way they were supposed to be, I suppose. And a lot of things changed within my body, but it seemed like a lot of doctors didn't really understand when I was trying to say, like, look, this ain't what it used to be. And one of the things for me is it was my period. It was not what it used to be. It was very, very different. It was very, very long. I had birth control that was kind of making it go a little bit haywire. And
mm,
I was like, what is going on with my body? And really, nobody had an answer besides take Tylenol or lay down or eat iron rich foods. And yeah, that ain't it, So it was definitely a very different situation. So in Repro Heal, what you're doing is you're looking at reproductive health across a lifespan. So not even just women that just had babies or women that are in menopause. You're looking at it from menstruation all the way through peri and menopause and all of that.
mhm.
Um, why do you think it's important to kind of look at that through the entire lifespan?
Well, the easy answer to that is that often when women and birthing folks are going through these processes, there's not a clear stopping and a starting of something else. For example, there are women who are currently menstruating who are experiencing perimenopausal symptoms, right?
Mm,
So that's they often these phases often happen and they overlap one another. And so it's necessary, I think, to look at diverse sets of experiences across time so that awareness can be elevated, first of all, about what this experience is like, but directly from the patient's lived experiences,
right.
right? So as opposed to segmenting the and not to say that there's anything wrong with studying it that way, but why I've chosen to approach it in this way is that there are often individuals who are within multiple cycles simultaneously.
Mhm.
And bridging gaps, even if that's not the case for patients, right? For specific patients who might be a part of the project, which I would venture, I guess, to say it would be, but let's say
Yeah.
it's not. Um, is that information not going to be useful to you if you are in the premenopausal phase and you eventually will reach the menopausal phase, right? So looking at it as a continuum and looking at it as a lifespan experience, um, both provides information to individuals who are in any given phase to sort of crosstalk,
Mhm.
but also provides resources and information that can bridge across those gaps as well. So I think that's sort of why I approached it in this way: is that you could be at the juncture of multiple phases simultaneously, but even if you're not having the ability to cross talk across phases, and provide information and resources for patients across phases is important.
Yeah, the information aspect that you're intertwining in this, I think is probably one of the most important. And just from a personal experience, most of the women in my family have hysterectomies. So they have never experienced menopause. So I have nothing to go on. I don't know what it's like. I don't know where it comes from, what it feel like, what age to expect it to happen, nothing. So just from like an information standpoint, I don't have anything to go by, and I could Google it, and I can kind of do that. But what I typically get is very generalized information and then I see images of people who do not look like me. So
Yeah.
I don't want to take the advice of someone who doesn't look like me, especially considering just about every woman in my family has a hysterectomy. So what does that look like on your end in terms of how information is trying to like going to be disseminated? Like where do people even think to go for help with this?
So I think so there's two parts to the question that I want to touch on. There's one piece when it comes to because definitely have women in my family who have had hysterectomies as well. And uh, the ones that I'm thinking of are fibroids related, right?
Mm, yeah,
This is related to menstruation, and it's a condition that impacts how you move through menstruation, the amount of pain you might experience. And so for the women who were in my family, the first option was various surgeries of different levels of intensity and invasion, right? And then there's also hysterectomy when
yeah.
the issue continues to reoccur. Um, so this is also why I'm having that conversation across time spans, because there may be options available that help us avoid that, right? So, for example, there are certain contraceptives that might have negative impacts, but there are also some that might help with the management of dysmenorrhea and fibroids and things like
Yeah.
this sort, right? So that's why we're having those types of conversations. Where do you go for resources? One of the things that the project is intending to produce is a toolkit for
Oh,
patients and
yay.
one for
Okay.
providers, right? Just something handy little something or other, both digital and in print, that we can take to the doctor with us when we go so we can ask the questions that we need to get the answers that we need back,
Gotcha.
that kind of thing. Places where we can take notes and deliver that information to our provider so that our provider can give us the right tools and information. I think the other piece of things is that folks don't know that I found out that helped me want to move forward, like investigate, is that sometimes when you write pharmaceutical companies directly, you can get access to free and low cost medications just directly from the pharmaceutical company. So if there's an issue with insurance, for example, for the underinsured or uninsured, these are options that might be available in terms of economic, socioeconomic level, income level, that folks might not know they have the ability to access. So we'll be looking to disseminate this information to patients using our resources, our social media, of course, but the toolkits for patients as well as the toolkits for providers on providing culturally informed and responsive care. That might be another reason why patients aren't seeking as much from their providers as they might want to. So we're offering resources through the project of diverse sorts, um, and utilizing our dissemination channels to get that information out to folks.
Oh, I love that. And a lot of the work we do, well, honestly, all the work we do here at the Patients Program has something to do with the community.
Yeah.
And it's very important that in the work that we do, a part of our framework is to disseminate. So we have to give back what we learned and what we gathered from our research. But we also involve the community in it because it's important for us to make sure that the things we're looking at actually involve the people that we're looking at. So how do you plan to incorporate the community within this project?
So there are a couple of different ways. First, the project itself involves listening sessions or before listening sessions. There's going to be focus groups and interviews, as well as a photo voice methodology piece where we have the patients and participants take pictures of their lived experiences, and we utilize that data as well. So how am I having the community involved? Participants. This project is built and centers on, say, patient voices. It centers on the voices of those who have lived experience. It does not move without that. So that's one area, is that this is a lived experience centered project, and we're looking to bridge gaps based on what folks' lived experiences are and what gaps they say are present, as well as the strategies they offer us on how to get around some of those gaps. So that's one element. This is completely built on community members and their lived experience. The other piece is that the overarching governing body of the project is an advisory board made up of perinatal clinicians, obstetric and gynecologic clinicians, patients with lived experience and caregivers, community-based organizations. So my two project advisory board leads, Miss Delana Watkins, who I'm Dr.
Yeah, we
who
love
is in this
Delana.
lounge, love her so much. And she's handling with the more the perimenopausal piece of things, given her experience and the resources that Women's Wellness Lounge offers. That's also going to be one of the tools that we use for dissemination to get that information back out to the community. And then there is Dr. Rika Wilson, who is the originator of Brown Girl Wellness.
Ah,
Um,
cool.
so I'm working with both of them as the advisory board leads, but also we're going to be utilizing their connections and their services and their resources to get the information back out once we obtain it and get it able to be disseminated.
That's exciting. I think that's probably one of the most exciting parts for me. I don't even work on that project, but I'm so excited about kind of peeping my head into your office and learning more about it and actually kind of taking part in it because I I can see the benefit from my end, but I really love the aspect of kind of like weaving the community in this and not leaving them behind, making them be a part of the whole project. So I think that's what I'm most excited about. And this will be my last question for you. What are you most excited about for this?
I think I am most excited about, I'm excited about the conversations. I'm excited about not only bringing awareness, but just bringing the conversation. Like, I find that conversations surrounding menstruation and perimenopause and things that women are disproportionately vulnerable to are either situated in the icky pile where folks don't want to talk about it, or and there's a stigma surrounding the conversation, or there's shame, or there's something of that sort. When this is a part of the lived reality of our lives, so I
Yeah.
think that's one thing that I'm very, very excited about is shifting the narrative, shifting the conversation, making it normalizing conversations surrounding menstruation and perimenopause. Um, but also, I think I'm most excited about the end result. And when we're able to gather the information, we're able to analyze the data, and we're able to bring it back to folks and say, okay, this is what we found. This is what y'all told us. These are the strategies you highlighted as ones that would reach you. And these are some of the things that you can do when you go into your doctor's office and you have these questions. This is how to frame them so that you get the answers you want.
I see this being valuable for their spouses, partners, men. I really see it being valuable for everybody as a whole because a lot of the time they really don't understand the gist of exactly what it is that we're going through and what we're supposed to ask, or why we act the way we act, or why at that time of the month don't touch me. And I think that these tools are going to be very useful for them as well, just to kind of paint a different picture, like, okay, this is what it is, like, I'm going to the doctors for this is why I feel like this did this to me. And it'll probably help a lot of people be able to put the correct words to exactly what they're going through. That's exciting. I'm really happy about this project. I'm excited. I really am. This is going to be amazing. And
Thank you.
listeners, I want y'all to follow along with us on social media because as the project progresses, we're going to be able to disseminate some things as we go. There might be information about how you can be involved. So please continue to follow up with us. Follow us on any social media. We have Facebook, Instagram, LinkedIn, but connect with us and let's see how we can involve you in the project. So thank you so much, Dr. Jasmine K. Cooper, for being here, and we'll see you next time. Thank you, everybody.
Thank you for listening to the Bridge Podcast. To learn more about the Patience Program, visit our website at www.patience.umaryland.edu.